What I will love to tell families is almost universally, this is not something you caused. This isn't something that you ate the wrong thing or went exercising that day. What happens when an encephalocele happens is a signal either turned on or didn't turn off properly and allowed that connection that's already there when babies are developing to not develop in the appropriate fashion. So with that signal, that interruption in that signal that says close this book, can be interrupted. You can have a genetic predisposition. So some encephaloceles can run in families or certain ethnic groups. We do see that. It's rare though. Most of the time we don't think there's a direct genetic cause. Some environmental factors can cause it. We think particularly in spina bifida, which is another condition I treat where the opening is in your spine, that in certain groups of people, folate metabolism can affect that. There's some belief that that might affect encephaloceles as well, that if we give folate in certain patients, that may affect that signal. But again, that has to mean that that's that signal that's affected in your baby. And because a lot of processes are going on at the same time, there can be multi-factors that sort of affect that. In the overwhelming majority of kids, we don't know what led to it. And it may just be as simple as that signal, the light switch just turned on or off at the wrong time and led to that abnormal connection. In part because those connections are there. That's the normal development for there to be a connection. And it just has to have another signal in order for that connection to be disrupted.